are looking to apply for a United Way grant, I will go through our priorities and our funding process. Okay, great. So thanks everybody. I really appreciate you being here. So welcome to our annual informational funding meeting. This is our mission statement, of course, but I'm sure you all have memorized. Together we fight for the health, education, financial stability of every person in our community. Thanks all for being here today. And I just want to take a moment, like I like to do on these presentations, to just reflect and just take a moment on all who we've lost during COVID. It's been a very tragic 2 years. I know you've all been on the front lines of this. And we have, almost lost 1 million Americans to COVID. So it's just been so devastating for the last 2 years, everything we've all been through. So I just want to take a moment. Thank you. So you all probably know we recently did a strategic planning update survey to our community. We did receive back over 400 responses, and through the responses that we received back, we were able to verify our priorities, that they are in alignment with our donor directors. We did review this plan by our Community Impact Committee and our Board of Directors. They voted for us to continue to work on our current priorities, as those were the community needs, many exacerbated by COVID, as well as what our donors were most interested in investing in. So a visual look at our community investment strategy, you can see that each year we host a community conversation and needs assessment of our community needs. This year we added in a letter of intent process. Thank you all for your submissions to our letter of intent. And if you don't know what I'm talking about and you're still interested in applying, please email me offline and we can discuss. And I also wanted to mention that our community conversation this past year was around youth, around education, youth mental health, remote learning. The request for proposals, you'll be seeing the key dates in a moment, but it will be released on February 7th, so just a couple of short weeks away. Then, of course, we will convene our grants review process once we receive back your submissions, your full proposals. And by now, you would have received an email from us indicating if you were invited to apply to put in a full proposal to our community fund this year. So again, if you don't know what I'm talking about, please talk to me offline. And then, of course, our awardees will be notified if their proposal is accepted by our grants reviewers. Then, of course, they will receive their award notifications and they will receive their contracts to begin the next fiscal year. So that is a look at our process. As I mentioned previously, we are keeping our revised funding priorities the same as the last time we went through our strategic plan. Under health, we intend to increase access to healthy food for families in our community, the outcome being that families will experience greater food security. Under veterans, we intend to ensure that program staff and volunteers will increase access to affordable housing and legal services for veterans and their families, which provides increased accessibility to affordable housing and legal support options for veterans. For financial stability, we will improve access to resources to alleviate short-term financial crises in order to increase local families' economic position, which will increase financial assets for ALICE and low-income individuals, and we will discuss ALICE a little bit more later on. Under education, we have two categories. We intend to increase opportunities for positive youth development and literacy services. The outcome being youth will enroll in programs that develop positive behaviors and or read proficiently at grade level. Under education, we will also develop opportunities for lifelong learning to increase skill-based development, which results in increasing families' access to education and workforce training programs. And you will see some updated language, of course, in our request for proposals like we do every year. We included a COVID section as well and updated relevant data. And you will see some language around youth mental health as a result of our community conversation. The key dates that I wanted to go over with you are February 7th, when we put out our request for proposal. They will be due back 6 weeks later. On March 18th, we do not offer any extensions or exceptions. I know it's a COVID year. I know it's third COVID year. So we're letting you know with plenty of advance notice. So, I beg you now, in front of all of you, please do not submit at 4 p.m. on March 18th, which inevitably I know I'll receive a lot of proposals because, gosh forbid there's some sort of glitch on your end, we don't offer extensions. So my advice, I'm saying it again, it's being recorded, please, do it the day before or something, or, have multiple people have access or what have you, whatever you can do to just make sure you're not in that crisis situation, because we want you to apply. We want you to have that, best shot to apply. So we don't want you to see yourselves, put yourself in that position. So anyway, I'll get off my high horse and continue. Our technical guidance PowerPoint will be available on our website. And of course, any technical questions and programmatic questions can go to ci-inbox@uwdor.org. Rebecca, many of you know, our technology and everything wizard back there. She and I both look at that inbox and provide that technical support. If you do send me a programmatic question, I likely cannot answer it. If there is a question I can answer through CI Inbox, I will answer it. And if it's not appropriate for me to answer, I will just let you know that. Like I said, our award notifications will then be anticipated of June of 2022, which is the year we are in, which is wild. And then contracts are executed on July 1st for a 1-year time period. We do have year-to-year funding. So that is our process. So if you apply this year and receive funding, you are not guaranteed future funding. So just keep that in mind too. Our community investment process is a thorough and intensive community grants review process. We have up to 200 grants reviewers every year that participate in extensive evaluation and scoring, both online and through panel discussions. So there's opportunity for qualitative and quantitative feedback. We bring all of those extensive notes, all of those scores, all of those data, past outcomes, all the information we possibly have to our Community Impact Committee that facilitates the allocations process and decides the final dollar amount. And then we have a board presentation and they provide that final approval. It is a 6-month process from now until July. So what we expect of you is successful observation of a required program site visit, and the last 2 years we have done them virtually. Despite that, they have gone very well and worked very well. We've done them on Zoom, and the reason I'm mentioning it now is I'm hopeful that won't be the case next year, but I just want you all to know that we are flexible. We want to make sure everybody stays safe, and we just want to work with you to see however we can that your program is going well, folks are being served. We really want to be your partner. We offer, of course, our mid-year and end-of-year report, and the expectation is that they are sent in on time, and if they are not, of course, that information is taken up to our Community Impact Committee during the process of providing funding for the following year. So please take your site visit and your reporting seriously, because we try to make it as streamlined as possible, but these two pieces are extremely important. And of course, we always look for recognition of our partnership on your website and on any relevant program materials. If it's a program specific on your website, you can have us in that area. We don't expect to be plastered all over the place or anything like that, but where appropriate, we would like to have that recognition and partnership available. It increases the visibility of your program and of our partnership, so we find that very important. And social media, of course, is also great. We hope that you, of course, will attend our events as needed. And again, the last 2 years, many of them have been virtual. So, however you attend is great. We just want you there. We want to be able to show folks the incredible work that we are doing together, you're doing on the front lines, and that we are investing in. And of course, we do expect you to have your organizational profile on our volunteer portal and our 211 helpline. As a result of granting with us and just partnering with us, you don't have to be a community fund recipient to receive many of these services. We do provide consistent access to volunteers for your program. And again, we've continued to have those opportunities virtually throughout the pandemic and distanced. And in fact, we've had 10 MLK projects over the last couple of weeks. Of course, we have nonprofit professional development trainings like today, so thank you all for being here, and we offer these a couple times a year with lots of really relevant topics, and I know I'm still digesting everything I learned at the last 3 sessions. And of course, we have an excellent day of sharing essential in-kind program. And I know I put Rebecca's contact in the chat a couple of times, and I'll go over that program a little bit more in depth in a moment. But it has been critical during COVID and providing access to those resources. And of course, as I said, we have our community conversations, and we try to lend that important output, important information on community topics that are relevant and urgent and occurring now. So during COVID, of course, youth mental health has been a crisis. Remote learning has led to educational outcomes being not quite on the same level for all folks, depending on what their school system has chosen and what's available. So we've been looking at all that information to see how we can help provide that support to programs to provide that out of school learning, which we know really fills some significant gaps. And of course, we love when you promote that awareness by attending our United Way fundraisers. And again, they've been online, so it's easy as a click of a button to join our fundraisers right now. Hopefully, we will go back to in-person sooner or later. Of course, our Days of Caring, like I said, we just had 10 MLK days of service projects. And if you haven't signed up for our Equity Challenge, it's not too late. I know we put that link in the chat box a number of times today. It's very important to our diversity, equity, inclusion work. So I really hope that you will sign up if you haven't. You don't have to participate the full hour every day, although of course we love you too, but we recognize that everybody is a different type of learner. So we have a podcast, we prefer to listen, we have an article if you prefer to read, and a video each day on a different topic that's related to DEI. So we really hope you can participate. We did have over 300 participants that are focusing on improving their personal and professional DEI learning. And then, of course, we have other projects throughout the year, our National Volunteer Week, Day of Action, 9/11 Day of Service, and Make a Difference Day. And our volunteer portal, of course, you have access to those opportunities throughout the year. So you can put one and done days, or you can put consistent ongoing volunteer opportunities on our volunteer portal, which is volunteer.uwdor.org. And like I said before, we do require organizations to keep their volunteer portal profile updated. Like I said, I would go over this more a little bit, our Days of Sharing in Lewis Greenspan Children's Corner. So during the pandemic, we've been very flexible. Rebecca does an exceptional job in this program, and I know many of you work with her, and she's just done such a fantastic job. I can't give her enough credit on having different opportunities for folks. So keeping everybody safe, having curbside opportunities, distance opportunities. We also had our diaper drive where we gave away 100,000 diapers over the summer. We had our school supply drive, gave away $20,000 worth of school supplies in the fall. And we are serving families, children, households in crisis. Many are experiencing homelessness, they're unhoused, or they are survivors of domestic violence, foster children, formerly incarcerated, what have you. We want to be able to make sure that we can provide them this really essential support, such as hygiene items, school supplies, clothing, toys, books, masks, PPE, everything, you name it. And if we don't have it, work with Rebecca. We have sometimes some restricted funding that we're able to direct ship items to your agency. For example, a couple weeks ago, we were able to send a crib over to a new mother through an agency that we work with. So just keep that in mind. keep Rebecca's information at, make a post-it note right now, put it on your desk, because sometimes something's going to come up and then you reach out to her and we can help. Our professional development trainings, like I mentioned, we have a wide plethora of topics that we offer. I'm not going to read them through line by line, but you can see we focus on a lot of different areas around marketing, planning, fundraising, COVID, diversity, equity, inclusion. We always make sure that we have a topic related to diversity, equity, inclusion. And we have tuition discount programs as well. So if you're an adult learner looking to go back to school, you can receive a discount at Mount St. Mary College or Marist College. And like I said, asset limited income constrained employed is ALICE. Our ALICE report, I think, is very powerful. So if you haven't had a time to look at it, please go through and just click on that link right now, unitedwayalice.org/New York. And I know many of you probably cover multiple counties, so it's not just Dutchess or Orange data. If you cover 7 counties, you can look up all 7 and look at a side-by-side. You can take a look at, the different households that have been impacted by the pandemic. Look at how, people's income is impacted by different demographic factors. It's really excellent data resource, and of course, really demonstrates the need in our community. We are contributors to ALICE, like many of United Ways, and we really hope you take a look at it. And, even if you're writing federal, state, regional grants, that data resource is really excellent too. Like I said, recently we have had our community conversation around youth mental health. We do have one every year, and unfortunately there's been so much need, forever, but the last 2 years have been significant. So we try to make sure we're very timely and responsive to the crises that are happening. Course 211. I know I don't have to quiz you on this because you all use it frequently, right? This is where you refer folks to if they have a question that you can't answer. And if you don't, please make sure that you just make a mental note right now or another post-it note on your desk, 211. So it is our human service helpline. It's 24/7, 365. We always say burning building, 911, burning question, 211. So, for example, during the pandemic, we saw calls to 211 increase about 50%. We saw people asking in the beginning of the pandemic, what is COVID? And then later on, where can I get tested? Then later on, where can I get vaccinated? Then later on, how can I, make sure that I'm not evicted? So everything under the sun, call 211, because even if it's where can I get my recycling picked up, or where can I receive senior care for my elderly parents, what have you, 211 is your one-stop resource. And we never like it to be a best kept secret, which we refer to it like that sometimes. So please, 211. And thanks to you, we're able to help 232,738 people. So that's really significant, and that is because of the partnership with all of you that are on this call. So we're very appreciative. That's through everything that we've gone over, through our 211 helpline, through our funded partners, through our prescription discount cards, through our essential in-kind program, through our volunteers, our emergency food shelter program, all of it. So, please give yourselves a round of applause because you are all amazing. And that is the end of my presentation. I'm going to take myself off of this so that I can open myself up to live questions. I know I went through it quickly, so I'll definitely stay on, especially I know many of you probably have some of those grant-related questions. So I'm going to stop my share and open up the floor. Great. I'm just going to give me a moment to get back up to speed and see if there is any.
I just wanted to thank everyone for, being on with us today. And there was a lot of information. I always learn something new. The goal of the last part is just for us to be transparent, answer your questions, let you know where we're going. And, we really want to make sure that you do get your applications in on time and just make it as easy as possible for you. So, please give us a call or, chat right now. You can ask questions or anything. And then I would be remiss if I didn't thank this wonderful staff in front of me, Melissa, Rebecca, Emily, and I think Isabella is still on, for putting today's sessions together. I thought it was terrific, and thank you very much.
Thanks so much, Jeannie. Appreciate it. Appreciate you being here all day, all your support. And, I know I learned so much from every single presenter. So I know they're not on right now because